Pleurisy or pleuritis is an inflammatory condition affecting the pleural, the thin membranes that line the chest cavity and surround the lungs. This condition can cause sharp chest pain that worsens during breathing, coughing, or sneezing. Understanding the causes, symptoms, diagnosis, and treatment options for pleurisy is essential for effective management. Anatomy of the pleural. The pleural consists of two layers. Visceral pleural, the inner layer that covers the surface of the lungs. Parietal pleural, the outer layer that lines the inner chest wall. Between these layers is the pleural space, which contains the small amount of pleural fluid that allows for smooth movement of the lungs during respiration. Causes. Pleurisy can be caused by a variety of factors, including infections, viral infections e.g., influenza, COVID-19, bacterial infections e.g., pneumonia, fungal infections, autoimmune diseases. Conditions such as rheumatoid arthritis, lupus, and other autoimmune disorders can cause inflammation of the pleural. Pulmonary embolism. A blockage in the pulmonary artery due to a blood clot can lead to pleurisy. Lung conditions. Pneumonia, tuberculosis, or lung cancer can irritate the pleural. Injury or trauma. Chest injuries, such as fractures of the ribs or surgical procedures involving the lungs or chest cavity. Environmental factors. Exposure to certain chemicals, pollutants, or allergens can lead to pleurisy. Other conditions. Conditions such as pancreatitis or certain types of cancer can also cause pleurisy. Symptoms. The primary symptom of pleurisy is sharp, stabbing pain in the chest, which may be worsened by breathing. The pain often intensifies during deep breaths, coughing, or sneezing. Localized. It may be felt on one side of the chest, depending on which pleural is affected. Radiating. The pain can sometimes radiate to the shoulder or back. Associated symptoms. Other symptoms may include shortness of breath, cough, fever, and chills if an infection is present. Rapid breathing diagnosis. Diagnosing pleurisy involves several steps. Medical history and physical examination. The healthcare provider will take a detailed history of symptoms and conduct a physical exam, listening for abnormal breath sounds e.g., pleural friction rub. Imaging studies. Chest X-ray, to check for fluid accumulation, infections, or lung abnormalities. CT scan, provides more detailed images of the chest and may help identify underlying causes. Laboratory tests. Blood tests may be performed to check for signs of infection or inflammation. A pleural fluid analysis may be done if fluid is present in the pleural space. This involves a procedure called thoracentesis to extract fluid for analysis. Treatment. Treatment for pleurisy focuses on addressing the underlying cause and relieving symptoms. Medications. Non-steroidal anti-inflammatory drugs and SAIDs such as ibuprofen or naproxen to relieve pain and inflammation. Corticosteroids may be prescribed to reduce severe inflammation, especially in autoimmune cases. Antibiotics. If an infection is suspected, antibiotics may be necessary. Rest. Reducing physical activity can help minimize discomfort. Pleural drainage. If there is significant fluid accumulation, pleural effusion, healthcare provider may perform thoracentesis to drain the fluid. Treatment of underlying conditions. Managing conditions like pneumonia, tuberculosis, or autoimmune disorders may require specific treatments tailored to the underlying issues. Pain management. Additional pain management strategies, including physical therapy, may be recommended to improve comfort. Prognosis. The prognosis for pleurisy largely depends on the underlying cause. Many cases resolve with appropriate treatment, especially when caused by viral infections or mild inflammatory conditions. However, complications can arise if pleurisy is associated with severe infections, significant pleural effusion, or other serious underlying health issues. Complications. Potential complications of untreated pleurisy include pleural effusion, accumulation of fluid in the pleural space, which can impair lung function. Abscess formation. Infection may lead to the formation of an abscess in the pleura or lungs. Chronic pain. Some individuals may experience persistent pain or discomfort even after treatment. Prevention. While not all cases of pleurisy can be prevented, some strategies may reduce the risk. Vaccination. Staying up to date on vaccinations for influenza and pneumonia can help prevent respiratory infections that may lead to pleurisy. Healthy lifestyle. Maintaining the healthy lifestyle, including regular exercise, a balanced diet, and avoiding smoking, can support overall lung health. Prompt treatment. Seeking timely medical attention for respiratory infections or symptoms can help prevent complications. Conclusion. Pleurisy is a painful condition resulting from inflammation of the pleura and can have various underlying causes. Early diagnosis and appropriate treatment are essential for managing symptoms and addressing any underlying issues. If you experience sharp chest pain, particularly if it worsens with breathing, coughing, or movement, it is important to seek medical attention promptly.